Hello. Hello,
Hi.
everybody. Welcome again. Welcome again. And I hope you've all enjoyed very nice, productive discussions at the local level and have had the most out of the 45 minutes to align together on the key challenges and issues, your key priorities, and to determine the next steps. And again, we're emphasizing that these discussions only mark the start of the APPIS journey. I mean, all the countries should have the opportunity to sustain this momentum after the summit. So without further ado, let me first welcome Mrs. Janan Berdali, the head of MetaMazon, Metastatic Breast Cancer Association, who is going to present on behalf of the Turkish Hub. The floor is yours, Mrs. Janan.
Thank you very much. And I would like to say thank you again for this opportunity. I do appreciate. Because we should talk, we should communicate each other. So that's easy to way raising solution. Now, as we know, preferences and decision made by governments or decision makers on a national and international scale in order to determine who, by whom the health services will be proceed, how they will be provided, how they will be financed, and how the service will be delivered to the users. So, which is very important for all of us. Actually, we just discussed, and we now I found the sharing. Yes, for us, patients, all stakeholders, patients, caregivings, and NGOs mean how to sort the problem out, and we decided actually educational meetings is most important thing because patients or caregivers don't know how to do, because just I'm talking about specifically not breast cancer or sorry or metastatic breast cancer, all chronic illness for important, but especially I'm so sorry, especially patients, cancer patients, because just I know this, cancer patients needs to educate and know what are they going to ask people, doctor. So we can say educational meetings are important. And on other stakeholders, pharma industry, we also say collaboration on raising awareness and working by contribution of NGOs, non-profit organization are needs, unique needs actually. So other stakeholders, Ministry of Health, actually we can't do anything for them as everybody, and global problem maybe, but we think co-creation of guidelines. Actually, we don't have any guidelines for especially cancer patients, how to work some principles. Other stakeholders, hospitals, and other health centers. I can say most of the issues are system related, which needs to be resolved by government. However,
I've as much as I can, but we can just copy and paste from what we discussed. Sorry, I tried to do this earlier. Huh?
Sorry.
You can continue, Mrs. Janan, please.
Okay. And patient advocate groups can play an important role in Turkey to raise awareness and provide educational support to patients. 10, maybe 15 years ago, there was no choice for us to provide educational support in Turkey. Now it's getting better. And another stakeholders, health, ignore. I think
healthcare professionals.
Sorry. This is chemo brain. I'm so sorry. Healthcare professionals, collaboration, physician associations for raising awareness for us. And actually, it's not really collaborate with pharmacist alliance, but still we thought, sorry, still we need to solve issues with the pharmacist alliance. We need to more closer interaction. So next slide, maybe. Thank you. What we can do? Actually, at the moment there is no proper data. We have main problem is there is no enough data collection and data management. If we ask to government how many people, how many women or men have or diagnosed breast cancer or other type of cancer, actually we can't really get any proper answer from them. So the data management are not able to reach. Action plan, patient advocates need to collaborate with healthcare system stakeholders. We just talk like this. And another gaps, priority gaps, is there is no regulation for inclusion patient decision-making progress. And resource and tools need, as we have been doing same things long time, for a long time, capacity building trainings and trainings on being patient advocate. And also ElAdl platform is, maybe you know, like the ElAdl. But this education, how can we give the patient and also the government We have really no idea, to be honest. But patient advocates need to collaborate with healthcare system and stakeholders, which are hospitals, patient advocate associations, NGOs, something like that. Yes. Another slide, please. Ignore.
This is the end of presentation.
Okay. Oh, yeah. No, I would like to talk more.
Thank you very much.
Okay, thank you.
Thank you so much, Mrs. Janan, for the sharing. And now we'd like to welcome Mr. Rod Padwa, the Asia Pacific lead for the Global Chronic Myeloid Leukemia Advocacy Network, to present on behalf of the Philippines Hub.
Yes, thank you, Reem, for the introduction, and being if we be allowed to show our slides. So it would seem that the Philippines, from the previous presentation of Sejal, is doing quite well, but no, and it is a big but. We still have many things in our planning horizon, actually. And these are the key stakeholders we are targeting to engage. For the medical, we will try to engage in partnerships for shared advocacy campaigns. We have shown how a unified voice can produce so much results, and we are continuing with that from the medical partners. The political champions, we might work in our favor for this year because we are having a presidential election in the coming months. And of course, the politicians would be making promises and promises. So it's time to rally behind the enactment of health bills. For international patient organizations, this is another strategy of ours for and we will try to leverage our data of disease studies and the burden of it by securing resources or in the end securing resources from the IPOs. For the civil society, a lot of networking in the ground level should be there, and we have to convince them that it is for a shared purpose. The digital experts will be working hand in hand with us. We know how valuable, even or more so in this time of the pandemic, how data can leverage budgets. But first, the infrastructure must be there. We have to convince the budgeting people that these are validated data and from the patients or from scientific data. For the local government units, we have to identify the champions in the local level, so that there will be or who we call movers for the health projects, because not all of them are familiar with our cause. For the ministry or the Department of Health, we have to find the champion, okay, the enabler on our cause, because many times they would present to us that their lawyers or their accountants. It's okay, but we need the champions. For some, now that we have identified the key persons, we identified the gaps or the challenges that we think needs to be still addressed, again on the data side, on how we capture, we process, we share, and of course how we use the data, because we can share, but if they are not using the data, those persons that need to use them, it's all for nothing. So the action plan is first to build capacity building on data processing, and then of course the infrastructure. Actually, for the ministry, for the Department of Health, the platform for data is already there, but whoever wins the contract for the private sector, they have to synchronize the platform with that of the government. Otherwise, it would just be, in IT language, GIGO. It means garbage in, garbage out. And we have to digitize, right? Especially now in these COVID times. Another gap, as in previous years, it seems that we will never run out of capacity needs for the PAGs, especially for HTA. Um, of course, the survey says that in the Philippines, it's okay. We're kind of in the upper bracket, but it also depends on who you ask in the survey. So some of our members might actually not be at par with their leaders in terms of HTA, and that's what we're looking at. Leverage on mature PAGs to help starting PAGs. This will be sort of a strategic direction for the mature PAGs. But again, how do we source? How do we find the starting PAGs? Lately, through social media, we can find them. You know, the Philippines is made up of 1,000 islands, 7,000 islands, in fact. And the only way to find the starting PAGs is through social media. And we'll try to find them wherever they are. And then we'll do some mapping on the stakeholders that need to be identified. Another gap is to expand the medicines in the drug formulary. This is not going to be easy because it's, again, it will involve the whole HTA process, and the first part of which is to determine, and this would be a lot of influence, if the medicine or the technology for HTA process is in the WHO list. So taking all of this action plan, we crafted a declaration of commitment. The 3 E's: elevate, enable, and empower. So elevate patient voices, and then to enable patient communities by having more HTA trainings for patient groups, and empower patient communities. All of these, the 3 E's, we have this as time bounded, and it's up to us to monitor the implementation for this. In the interest of time, this is all we have to say, but of course, the details are in the plans. Thank you, Reem, for the opportunity in behalf of the Philippine team.
Thank you very much, Rod, for the very clear commitment and the action-oriented plan. That was fantastic. Thank you so much. So great outcomes. And now, last but not least, let's invite Mrs. Kelly Duplessis from Rare Disease South Africa. I'm not sure if I'm pronouncing the name correctly, so I hope I am. Mrs. Kelly is going to debrief us on the challenges and priorities in South Africa. Thank you so much.
Perfect.
The stage is yours.
Thank you so very, very much. I am just trying to find these particular slides. I have a ton of slides currently open on my desktop, so if you can just give me 1 second. I'm just checking, are they coming through yet?
No, nothing yet.
Okay, if you can just give me 1 sec. There we go. It should be coming through now. Let me just put it into big screen.
Yes, it is. I
Yep.
appreciate putting
Perfect.
it on full screen.
Yep, there we go. It should be working now.
No.
Display settings, yes. Yep, perfect. Got it?
Perfect.
Okay, great.
Thank you.
Thank you very, very much. All right, so thanks so much for the opportunity to be able to present. We had a very, very brief discussion around some of the challenges, etc., that we experience in the South African landscape. We have identified, and I think maybe it might be best if I shared a little bit of the background in terms of the discussion first, prior to sharing the outcomes. But we really have felt that there is an improvement towards working together across disease areas, which has been really, really good from an advocacy point of view. However, we still feel that the patient voice is very, very diminished, in the South African context, and that has resulted from patients being stigmatized and having adverse negative impact in terms of sharing their stories or advocating for themselves, which is one of the big key areas that needs to be improved in order for us to be able to improve our health policy shaping in South Africa, but also more importantly, the reliance on data and our inability to be able to access available data across the board has also had a negative impact. So if I can go back to the key stakeholders that we've identified, South African still remains a two-tiered healthcare system, so it's very, very different from each other. We have a state sector, we have a private health insurance sector, and those two sectors are worlds apart. So we have to engage and duplicate our work in terms of addressing multi-funders, and we thought that the channels to engage there would be collaborative initiatives, roundtable discussions, and a lot of tactical touch points. With regards to our regulators, once again, because of that two-tiered healthcare system, we have regulators on both sides, and we really need to improve our face-to-face discussions around that and improve the multi-stakeholder roundtable discussions that get had to ensure that there's an industry-wide perspective and that industry-wide discussions can take place, and it's not one side of the table speaking down at the other. With regards to healthcare providers and service providers, we feel that there's a real need for them to still be included in policy reform. Ultimately, they are the ones responsible to being the service providers, and it is important that we take their areas of concern in as well when developing these policies. And there we felt that educational support on advocacy and what is ultimately necessary for them to be able to communicate needs to be obviously included. With regards to civil society, this doesn't only include patients and caregivers, but includes healthcare users across the board. And educational hybrid meetings seem to be the most viable touch point from that perspective. With regards to engaging with our government, collaborative innovations and roundtable discussions seem to be the best approach. And with regards to our multi-stakeholder partnerships, including the likes of academia, research, etc., we know that there's a need to improve the data and assist with publications, etc. And this is a prime contact point as well for bringing in the patient voice. So with regards to health policy shaping and the priorities and gaps that we've addressed, so communication with regards to that area, we feel that one of the action plan points is development of consensus to key issues that need to be addressed across all opportunities across the board, regardless of what disease area you're working in. We need to develop appropriate media messaging that speaks to those key issues. And then obviously the efforts need to be consistently applied. So you're continuously having to reinforce because of the level of advocacy and the existing systems that we have in place and the limitations that are brought around by that. The resources and tools are required is, again, the patient voice needs to be included, and we need to make whatever efforts we can to strengthen that patient voice. And in South Africa, we have 11 official languages, which makes it really, really difficult from a communications perspective. So to be able to develop materials in a multitude of languages remains a key focus area. With regards to capacity building, we want to be able to highlight issues that we know are a need across the board, but we also need patients to be able to take ownership of those, and also for the service providers, etc., to be able to be responsible, and for there to be a form of accountability when it comes to actually development of these of policies. So you can write up as many policies as you want. If you don't have any accountability for them, they fall flat. And to do this, we need to empower patients. And we have something called our Patient Health Charter, which we've determined is a key document that we need to develop materials around to educate patients, as well as monitoring and reporting tools. One of the areas which I mentioned earlier was the issue around stigmatization. So we thought maybe to develop some form of an anonymous reporting tool where you can raise these concerns, etc., and put them forward without having the risk of being stigmatized would be great. And then lastly, with regards to the patient-centric data, we know that we need to have a unified voice. And to do that, we need patient-led registries, because in the South African context at the moment, there is a lot of information and data available, but it is not made readily available to the advocates that are trying to push for these policy changes. And until we've actually have our own data that we can put forward and use to underpin and augment the services that we are trying to advocate for, we are still finding ourselves on the back foot. So development of patient-led registries where we can accumulate that data ourselves is really something that needs to be handled. So yes, in the interest of time, I think I'll leave it there. Thank you very much.
Thank you so much for the excellent sharing, and all for the excellent sharing and for providing your perspectives. Now, and before I hand it over to Sejal to wrap up the day, let me remind you to fill in the feedback forms by clicking on the feedback button at the bottom of the screen. Please, we really highly value your feedback and to know what went good and what went bad. So please manage to click on the feedback button at the bottom of your screen and fill up the feedback form. This is very, very important and will be very useful for the upcoming days and the upcoming events.